Welcome and thank you for joining us today for our webinar. We are going to be talking about healthcare in Ontario. Now, I'm just going to tell you a little bit about our project. My name is Ingrid and I will be your presenter for today's webinar. I am an employee of Costi Immigrant Services and we are the coordinating agency for the Orientation to Ontario project that is funded by Immigration, Refugee and Citizenship Canada. We're also funded by the Government of Ontario, and this project was created and designed to provide settlement, you know, support to newcomers to Ontario and help them to make better and better informed choices. Costi Immigrant Services is a multicultural agency and we serve over 39,000 clients annually. We have 17 locations in the Greater Toronto Area. And we are the provincial coordinator of this project. So we coordinate the project right across Ontario. On our agenda for today, we're going to be talking about an introduction to the Canadian healthcare system overall. We'll discuss Ontario Health Insurance Plan, which is for short, we refer to it as Ohip. We'll talk about how you can apply for Ohip and how you'll use the coverage. There are some other healthcare services that we will delve into. We will look at how you'll find medical facilities across Ontario, including hospitals, walk-in clinics, urgent care facilities, and then we'll talk to you about the available resources that we've made available to you on our website. Now, Canada's healthcare system is publicly funded and it's administered at the provincial and the territorial levels. Now, you'll hear the term Medicare, which is the term that refers to Canada's publicly funded healthcare system as a whole. Instead of us having a single national healthcare plan, we have 13 provincial and territorial healthcare insurance plans. Who's covered under these plans, you may ask? Well, all permanent Canadian residents and Canadian citizens are covered under the Canadian healthcare system. We also cover some refugee groups in terms of based on where they fall on the spectrum. So, for example, we cover some refugee claimants, namely government assisted refugees, blended visa office referred refugees, assistance, we have the Joint Assistance Sponsorship Program refugees, and also privately sponsored refugees are covered under this plan. What is covered under the healthcare system? Under this system, all Canadian residents have reasonable access to medically necessary hospital and physician services without paying out of pocket. There are only a few exclusions. All citizens are eligible for health coverage irrespective of their medical history, personal income, or their standard of living. Each level of government have a different responsibility when it comes to healthcare, when you look at the big picture. So at the provincial level, governments are responsible for the management, organization, and the delivery of healthcare services for all the residents within their province or territory. The provincial and territorial plans must cover all residents and ensure all medically necessary services provided by hospitals, physicians, dentists, when the service must be performed in a hospital. So we'll talk a little bit more about dental care as we delve into the webinar a little bit deeper because not all dental services are covered under the provincial plan. The provincial and territorial healthcare insurance plans consults with prospective physician colleges or groups, and they decide as a group the services that are medically necessary for healthcare insurance, and those are the ones that are covered. So any service that is considered medically necessary, it is covered under the healthcare plan. The federal government, on the other hand, provides healthcare funding to provinces and territories through the Canada Health Transfer process. The federal government is responsible for setting and administering national standards for the healthcare system through the Canada Health Act, providing funding support for provincial and territorial healthcare services, supporting the delivery for healthcare services to specific groups, and also providing other health-related functions. We talk about other health-related functions. We're looking at things like, for example, the provincial government provides support, health care to First Nations people living on reserves, the Inuits, serving members of the Canadian Forces, the Canadian Armed Forces, eligible veterans, inmates in federal penitentiaries, and some groups of refugee claimants as well. As we talked about earlier, we talked about at the provincial level, but also at the federal level, the federal government also chips in terms of refugee support as well. The federal government also provides tax support for health-related costs, such as tax credits for disability, medical expenses, caregiver and disabled dependents, tax rebates to public institutions for health services, also deductions for private health insurance premiums for those who are self-employed. Now, to access the healthcare services, primary healthcare refers to a range of services beyond the traditional healthcare system. So we're looking at our primary healthcare system, which is the core of how the Canadian healthcare system is designed. And this includes all services that plays a part in health, such as housing, income, education and environment, health promotions, illness and injury prevention, diagnoses, and treatment of illnesses and injuries. So our primary system, when we design our healthcare system, when it was designed, we looked at the full scope. So we took into consideration income and how will income reflect on health, and housing and how does that reflect on health. And so there are different divisions of health that comes under our primary health care, if that makes any sense to you. Now, we then have the supplemental health coverage, and the provinces and the territories also provides this supplemental coverage to certain groups of people, such as seniors, children, social assistance recipients. And what this does is it helps pay for healthcare services that are not generally covered under the publicly funded healthcare system. So under the publicly funded healthcare system, there are things like medication that are covered, but only for a particular demographic, a particular part of our society. Vision care is not covered under our healthcare plan, only for a particular section of our society. So what the supplemental health coverage does is, as it suggests, it supplements health services for those who are vulnerable, for example, seniors, children, and people who are less fortunate and have accessed the social assistance supports that we have in this country. Those who do not qualify for supplementary benefits under government plans pay for these services through out-of-pocket payments and sometimes their private health insurance plans. Now we're going to go into talking about Ohip, and Ohip is the Ontario Health Insurance Plan. The federal, provincial, and territorial governments plays a very key role in the administration of all the healthcare services, as we talked about earlier. And so Ohip is at the provincial level. The province pays for many of our required health services. Residents and citizens need to apply for this coverage. So this coverage is not automatically given to you. It has to be applied for. Once you're approved, you'll get an Ontario health card, and your health card proves you're covered by Ohip. That's why you'll need to have it every single time that you go to the doctor or you go to an emergency, for example, at the hospital for emergency. Now, Ontario does have one of the best healthcare systems in the world for Ontarians who qualify. The things that are covered under OHIP are doctor's appointments. You can, and when we talk about doctor's appointments, we're talking about appointments with your family doctor. Also, visits to the walk-in clinic and some other healthcare providers. So if you go to the walk-in clinic, if you have to see a specialist, those are covered. Visits to an emergency room, medical tests, and different surgeries, these are all covered under the provincial plan. There are some things, however, that are not covered, and for example, dental visits, cosmetic surgeries, and some medication is not covered. Remember earlier when I talked about the dental visits, I said that there are some things that are not covered and covered for some people. The supplementary health coverage covers dental visits for seniors, children, and those on social assistance. It does not cover for everyone else. Okay? Cosmetic surgery is also not covered. Your eye for the eye doctor, that is not covered, and the cost of medications as well are not included under this coverage. Canadians often have additional insurance to cover the things their provincial insurance does not cover. And there are also programs that does assist low-income families with these types of medical expenses as well. Now, there is an eligibility criteria, and we are going to look at minimum eligibility requirement. Now, the Ontario residents are eligible for provincially funded health coverage under OHIP. To be eligible for this coverage, however, you must be either a Canadian citizen, a permanent resident, or you must be among one of the newcomer to Canada groups who are eligible for OHIP as set out in the Ontario's Health Insurance Act. And we talked about those who were eligible previously. So we talked about the different refugee groups that were eligible for this service. Now, you must be physically present in Ontario for 153 days in any 12-month period and be physically present in Ontario for at least 153 days of the first 183 days of the first 183 days immediately after living in the province. Okay? So this is immediately after establishing residence in the province. Ontario must be your primary place of residence as well. So you cannot be living in a different province and then apply for OHIP. You will not be covered. You can get additional information from the website that is posted above here. It is a long website. However, if you go to ontario.ca, you will be able to access this information in more detail. Now, to be eligible for OHIP at least one of the following additional requirements must be met in addition to the ones that we talked about on the slide before. So you must either be a Canadian citizen, be an Indigenous person, be a permanent resident, or have a valid work permit, or have applied for permanent residence. Now, we have listed out of there are, however, 10 additional requirements to choose from. We've only listed these here for you, but there are an additional, out of the whole list, it's 10. So you can, again, go to the website and you'll see additional information. Now, your spouse and any dependents may also qualify if you qualify. Now, if you've applied for permanent residence and Immigration, Refugee, and Citizenship Canada has confirmed that you meet the eligibility requirements to apply, or you have not yet been denied. So please do visit www.ontarioimmigration.ca. There's a /en/ after OI _after _health. And here you will find the list that we are referring to. The additional 5 requirements combined with the 5 listed in the previous slide, you must be in Ontario on a valid work permit under the federal live-in caregiver program. So again, this is one of these requirements. So one of the following, you don't have to meet all, but one of these requirements in addition to the ones we talked about 2 slides ago. So you must have a valid permit under the federal live-in caregiver program, or you're a convention refugee or protected person, or you have a temporary resident permit, or you are a member of the clergy. All of this will qualify you. So you just need one of those. If you are a clergy member who can legally stay in Canada and is ministering full-time in Ontario for at least 6 months, again, your spouse and your dependents also qualify if you do. All right, so now let's talk about how you apply for OHIP. Remember we said that the coverage is not automatic, so you do have to apply for this coverage. Getting your health card is very important, okay? Now, you do need to provide some proof in order for you to get your health card. Your permanent resident card can be used, and it must be valid or expired no more than 5 years. One of your documents needs to also prove your OHIP eligible immigration status, and you may use confirmation of permanent residence, the IMM 5292 5688, a Canadian Immigration Identification Card, or your record of landing will also work as proof as well. You can use a Canadian passport, valid or expired no more than 5 years, a certificate of Indian status, certificate of Canadian citizenship, or certificate of naturalization paper document or card, not commemorative issue. There are 5 additional documents that can also be used, and you can absolutely visit the website we talked about. You can also visit www.ca/page documents needed -get -health card. If you've applied for your permanent residence card and you've received your approval letter, the letter must be on the IRCC's letterhead addressed to you as the applicant. State IRCC has confirmed you are eligible to apply for permanent residence in Ontario and Canada. And the IRCC document, for example, if it's a work permit, visitor record, temporary resident permit, or study permit, with a note confirming all 3 of the following. So 1, you've applied for permanent residence. You've met the eligibility criteria for permanent residence, and you have not been denied. If you fall under any of those categories with your immigration status, or if you're a convention refugee, for example, you must provide a letter from the Immigration and Refugee Board confirming convention refugee or protected persons status. All of this information can be found on the website that we've listed here. Please do take a moment if you do need additional information to locate this. Now, when you arrive at the Service Ontario Centre, you will either have to wait in line or take a number and wait for your number to be called in order for you to get access to the teller. At Service Ontario, they will take your application, review and copy your documents, and then they'll return the documents to you. Then your picture will be taken. There is absolutely no cost when you apply for your first health card. So you can walk into that office, you don't need to have any money as long as it is your very first health card. And these are some of the steps that will be taken. Now, when does coverage actually begin? Coverage may take up to 3 months to begin after you've been approved for it. Okay? There are, however, some exceptions to this rule. Now, some individuals do qualify for immediate coverage. If you are not in the group of people qualified for immediate coverage, you may wish to purchase private insurance. So the group that is eligible for immediate coverage are newborn babies in Ontario, a member of a military family, and an internationally adopted child under the age of 16. Okay? Coverage may take up to 3 months again. So even though coverage begins immediately after approval, for some, it may take up to 3 months for some of us. Okay? So some individuals absolutely will not qualify for it. Again, if you're not a newborn baby and you're not a convention refugee, then you will not. If you've also moved from another Canadian province or territory into a long-term care home in Ontario, you will immediately receive coverage. All right? So again, I hope that it is clear who gets coverage instantly. A convention refugee and other protected persons, a child who's a baby who's recently born in Ontario, children who are adopted and are under the age of 16. Okay, now let's talk about let me ask you a few questions. Did you know that you may be asked to reapply for OHIP? Well, this does happen. If you've been out of Ontario for more than 212 days in any 12-month period, you may have to reapply for OHIP at a specialized Service Ontario Centre that provides the full suite of health card services. If you are told that you do not or no longer qualify for OHIP, yes, you can appeal. Some people are not clear on that. So yes, you may appeal your Ohip denial if you have been denied Ohip. To request a review, you would send a letter, fax, or email with the reason why you believe you qualify for OHIP. Did you also know that OHIP application process for Ontario-born babies are different? If your baby is born in Ontario, the steps to apply for OHIP are different depending on whether or not the baby was born in a hospital that has birthing, labor, and delivery facilities, or they were born with help from a registered midwife. So you do need to visit www.ontario.ca/page apply-and-get-health card section for more information on that. And did you know that visitors to Ontario are not eligible for OHIP? We've gotten this question asked a few times. My family member will be visiting me. Will they be eligible for OHIP? Unfortunately, no. Family members are not eligible. Visiting family members are not eligible for OHIP coverage. Now, where will you use your coverage and how will you go about using it? It's pretty, especially if you're coming from a country where healthcare is not necessarily national, it does feel really good to have this coverage in your back pocket, knowing that if you don't feel well, you don't have to stress about going to see a doctor and getting some support. Now, how do you use your card? Your OHIP card must be presented at every medical appointment you attend. Please do not forget that. While the doctors will not turn you away, in most cases they will not, You do need to have your card ready for access, especially if it is not your family doctor. If you're visiting your family doctor, then they often know you, the receptionist will know who you are, and sometimes they will work through that with you, but please do always have your card with you. Your card information is also very private. It should not be shared with anyone at all. Now, there may be times when you have to share your OHIP number. For example, for your children, you may be required to provide that OHIP information to schools, daycares, and camps for your children in case of an emergency. They do need to have the child's health coverage insurance information. So do not be alarmed if that is requested of you when you go to register your children at daycare or at school. That's perfectly okay, but you do not share it with anybody else. The OHIP card is not to be used as identification. Now, many places will not accept this card, and you don't want to be giving people your health card number. There's a lot of privacy issues surrounding that, so you want to keep your card very close to you. Now, we talked earlier about some of the things that were covered under the primary healthcare system. Now we're looking under the provincial healthcare system, and this would be under OHIP. So what coverages are extended to you? OHIP provides extensive coverage for various health-related issues. For example, various health-related services. For example, doctors, so your family doctor, walk-in clinic, hospital visits and stays. So if you've got to stay overnight at a hospital, that is covered. Abortion services are covered under OHIP. Emergency dental surgery is also covered under OHIP. If you have to go to a hospital, if you're having pain and you are not covered, you can absolutely go to the hospital and present your OHIP card, and you will be able to access dental services. These are for in emergency cases. Now, travel, when we talk about travel under OHIP, I want to talk to you about these travel services. First of all, let me just recap the dental thing. Dental surgery in hospitals is covered. So OHIP covers surgeries like fracture repairs, tumor removal, reconstructive surgeries, medically necessary tooth removal. Prior approval by OHIP is required for that. And I believe that you can get that information from the hospital. Now, if you have to travel long distance for specialized medical care and you live in one of the following areas, OHIP may help to pay for your travel and accommodation through the Northern Health Travel Grant. So these regions are listed at the website that is listed here. Please do go take a look. We didn't want to list all of them because it would be so much. Now, podiatry services are also covered. OHIP covers between $7 to $16 of each visit to a registered podiatrist and up to $135 per patient per year, plus $30 for x-rays. You will need to pay for the remainder of the cost of each visit. The visits are generally, I've had to go to a podiatrist, and the visits could range anywhere between from $7 to $35. So anything that is not covered under OHIP, you do need to sub that amount. Optometry is also covered. So your eye health services are covered. OHIP covers the cost for one major eye examination. So remember we talked about that a little bit earlier. For vision and general health, every 12 months, OHIP will do that, plus any minor assessments you need, but only if you are, listen to this, okay? Because I talked about this earlier, that it is not for everyone. So this is covered only if you are 19 years and younger or 65 years and older. If you are not within that age range, OHIP will not cover for the eye examination. They will not cover for any other eye services at the optometrist. So this is something to keep in mind. All right. Now, there's also ambulance services. If you need an ambulance for a medical emergency, OHIP does cover a portion of the cost, and that depends on the circumstances. So this is something that you do want to check into as well. Now, OHIP does not pay for prescriptions. The company you work for, if you are working with a company that provides health coverage, many companies in Ontario do provide health coverage. So the company you work for may have an insurance plan that pays for prescriptions, and this insurance can also cover your husband and your wife and your children, your partner. Okay, you can also buy insurance from a private company, and these plans often pay for prescriptions as well. The Ontario Ministry of Health and Long-Term Care can also help you pay for prescription medication through what is known as the Ontario Drug Benefit Program. It's in short, it's referred to as ODB. This program pays for some prescriptions for people over 65 who get social assistance and long-term care patients. We have what is known as Trillium, the Trillium Drug Plan. This program helps by paying prescription costs for people who have drug costs that are high compared to their family's income. And then we have what is known as OHIP Plus. This program covers prescription medicine for anyone under the age of 24. Okay? So you will hear some people say, well, my medication is covered. It is covered under OHIP Plus if you fall within a particular age range. There are special drug programs, and this program pays for drugs that people who have, for example, HIV, schizophrenia, and other conditions. We've got what is called the Special Drug Program. And you can find more information on this if you visit www.settlement.org. You'll find additional information there. The Ontario Ministry of Health and Long-Term Care also provides what is known as an Exceptional Access Program. The Exceptional Access Program covers drugs that are not on the approved Ontario Drug Benefit List in special cases. There is the New Drug Funding Program, and this program covers certain approved intravenous cancer drugs administered in hospitals. Then we also have the Interim Federal Health Program, and this program helps some refugees and refugee claimants pay for prescription as well. There are many community agencies that can help answer your questions about health insurance. So to find more, please visit www.settlement.org and go to the link that says Services Near Me, add in your community, and there you'll be able to find additional support when it comes to healthcare and the coverage. A few things I want to highlight so that you can remember. Some services are not covered under OHIP. For example, some prescription drugs are not covered. Some dental services are not covered. Eyeglasses and contact lenses are definitely not covered under OHIP if you do not fall within the particular groups of people that we talked about earlier. Laser eye surgery is not covered under OHIP, regardless of what category you fall under. And cosmetic surgery is definitely a no-no. So if you're thinking about enhancements enhancements, there's no coverage under OHIP for that. That will come out of pocket. Let's take a look at some of the other healthcare services that we have in Ontario that you do have access to under the Ontario healthcare system. Okay? So, according to the Ministry of Health and Long-Term Care, mental illness and addictions directly or indirectly affects 1 in 5 Ontarians. That is a huge number. if you think about it. When you think about it, you count 5 people, and out of 5 people, 1 out of that 5 would have either suffered from or are struggling with a mental illness. And so, how do you find support if you fall into that category? Well, we do know that mental illness can affect our lives personally. It could extend to families and workplaces as well. So, what the province has done is to get assistance with mental health care, you may contact your family doctor. You could also go to a walk-in clinic and emergency room doctors who will provide referrals to qualified mental health service providers. Where will you find the support? You can get support from trained mental health service providers where you may incur a cost, or from a community health center that offers counseling services at no cost to you. You may get help at inpatient mental health services, addiction supports, residential treatment centers, early intervention clinics, hospital outpatient care, among other places. Please do go to www.health.gov.on.ca, and the remainder of the link is also listed right here in this webinar for you. Follow that link and you'll be able to access additional information. I've also provided this link at the very end of the webinar. Now, who will support you? The support for mental health services will come from psychiatrists. They provide counseling and can prescribe medications depending on your diagnosis. By the way, psychiatrists are also covered under Ohip. Psychologists, they hold generally a master's and or a doctoral degree in psychology. They are licensed to treat people with mental health issues. And you can also get support from social workers who can be clinical counselors who hold a master's or bachelor's degree and will usually specialize in a particular area. So again, as you can see, there are several resources that you can access if you do struggle with mental health, or if you know someone who's having a mental health crisis, you will know who to refer them to. Now, visit www.youroralhealth.ca for more information on dental health services. But dental health services are not covered under OHIP. Again, unless you fall in the categories that we mentioned earlier, dental coverage would not be eligible to you. So you may be required to pay for the services, and the cost ranges per dental practice. We don't have a particular number for you. You would definitely need to visit, I would say do some research, go to the different dental offices within the area that you live and get a good feel of how much they charge for whatever services. Make sure that you're comfortable with the office. It looks clean, they are professional and friendly with you, and ask a couple questions to see how best you can choose your dentist. Now, there are some services that you can access that will be at no cost to you. And some community dental programs have dental services that are free or less expensive than regular dentists. Where can you find these services? Dental offices with privately licensed dentists who will perform the services for you and your family. So the ones that I explained about earlier. You can go to your community health organizations, and they sometimes have specialized dental services or they have referrals. The colleges and the universities as well that teach dentistry have dental clinic programs in many cases. In these programs, dental students provide the services to you. They are supervised by their instructors who are licensed dentists and dental professionals. So do not be afraid if you are, dental services could cost a lot. I think for my annual cleaning that I do twice per year, I believe it rounds out to about $200. And that's just for my cleaning by the hygienist. I'm not talking about all the other services that I would need. So there are some public health programs through your community health department. They will have information about emergency dental services as well. And if you are in great pain or you've got a broken tooth and you need to access a dentist in the evening or on the weekends or on holidays, there is a cost for these services sometimes, but you can definitely contact your local hospital. They'll give you some information on that as well. Now, let's talk about children. Are there any services for children specifically? Well, here in Ontario, we have a program that is called Healthy Smiles, and it does offer free dental care for eligible low-income children. The program covers preventative routine, emergency and essential care, and dental services for children who fall in that category. And you can apply for this program either by mail or online. Eye care is another health service that you do need as we, you know, get older. I'm getting a little bit older, and as I get a little bit older, I don't see so well without my glasses anymore. So, whether it's because it's age related or you are unable to see simply because you have astigmatism or you have some other eye conditions, you do need to see an eye specialist at some point. So you may choose to visit any optometrist in your area that you live in. However, Ontario Health Insurance Program does not cover comprehensive eye examinations for adults between the ages of 20 and 64. Okay? Who do they cover? Children 0 to 19 and seniors over 65 years old. All right? There are some services for people who are blind, however, or have low vision. So if you visit the website www.ontario.ca/page/visual-aids, you will get some additional information on the assistive devices program, the Ontario's blind low vision program, and assistance for children with severe disabilities program. So through the assistive devices program, it's called ADP for short, you can have specialized glasses, magnifiers, and other optical aids, audio players for reading books, Perkins and other manual braillers for writing. That is something that is really good. There is also CCTV and computer-based reading and writing systems. There are white canes for orientation and mobility that you can access as well through these programs. The Early Intervention Program for Children, Ontario's Blind Low Vision Early Intervention Program, is designed to give children who are born blind or with low vision the best possible start in life. I'm very proud of this program because it specializes in, it's a family-centered service and it's funded by the province. And services are available for children from birth to grade 1. There are family support intervention services and consultation services as well. The Assistive Devices for Children with Severe Disabilities program, if you're a parent caring for a child with a severe disability, you may be able to receive financial support through this program. It provides financial support for low to moderate income families to cover some of the extra costs of caring for children or a child who has a severe disability. And this program is also funded by the Ministry of Children, Community, and Social Services. We have the link right here for you as well. The medical facilities that you will need to access, there are many places to access healthcare services covered under Ohip. So you can access the hospitals, walk-in clinics, family doctors, urgent care centers, community and healthcare centers. And these you will find programs that will work for you depending on what it is that you actually require. Please visit www.settlement.org for more information. Now, we've made the distinction here for you about urgent care versus emergency room. Now, when we talk about full emergency care is available at your local hospital. These full service emergency departments operate 24 hours a day, 7 days a week, and they provide optimal level of emergency care to everyone. Okay? Now, conditions that require attention in an emergency department are different from those that require care at an urgent care facility. The urgent care facility treats non-life-threatening minor ailments and is accessible if your family doctor is unavailable. So, we've listed a few of the emergency services, so reasons you should absolutely go to emergency. For example, if you have a chest pain or if a family member of yours is having chest pains, for example, you think they're having a heart attack, they suffer from angina, stroke or a mini stroke, moderate to severe respiratory distress, for example, shortness of breath, COPD, or an asthma attack. I can talk about the asthma attack because my mother struggles with severe asthma complications. And when she cannot breathe, if I don't have the right medication at home, or if I do have the medication and the medication's not working, I do take her to emergency. Severe abdominal stomach pain, appendicitis, if you suffer from irritable bowel flare ups, abdominal pain with fever, for example, obstetrical issues, that means pregnancy complaints, any condition that requires blood transfusions or any medical surgical emergency, those requires hospital visits. Urgent care, however, the focus of the urgent care centers is to provide care for illnesses and injuries that can't wait for your family doctor, but will unlikely require you going to a hospital. So we short form them, we call them the UCCs, the urgent care clinics. They will not provide continuing care for your chronic conditions, assessments, or long-term care residents or prescription refills, including those for narcotics. So do not go to them for those reasons. However, if you've got an earache, fever, sprains, strains, if a bone is broken, if you're feeling some pain in your ear, nose, and your throat, cuts that may need stitching, if you feel nauseated and you're vomiting, you've got flu-like symptoms. Again, any illnesses that cannot wait, but is definitely unlikely to require a hospital admission, you can go to an urgent care facility as opposed to going to the emergency room. And the reason we talk about this to try to help you is because sometimes the emergency wait times are very, very high when you could have had some medical assistance had you have gone to one of the urgent care centers. Now, if you're new to Ontario and you're waiting for OHIP, remember we told you before that there is a 3-month wait time for OHIP coverage. Now, we do recommend that if you're going to be here during that time, to try and find private insurance plans that can help you. These insurance plans are designed for people who do not have OHIP coverage at all and you're waiting. So that would be really good. You can visit www.clhia.ca for more information. And we want to, I'm not sure, you're probably thinking, well, how will a community health center help me? Well, community health centers are an extension of, not necessarily a walk-in clinic, but there's they're community healthcare places that provides health services, and they have healthcare professionals such as doctors, nurses, and nurse practitioners on their staff. If you do not have OHIP coverage, you may be able to get help here at no cost to you. All right? The CHCs, as we fondly call them, they're culturally sensitive and they provide care in different languages. They have anti-racism programs, domestic violence prevention and treatment, parenting education, drop-in programs for youth, and some CHCs offer integrated healthcare language and settlement programs specifically for immigrants and refugees. So if you don't have OHIP coverage, you're not eligible for OHIP coverage immediately, you can absolutely seek out the community health centers, all right? And Have you heard of Canadian Life and Insurance Association? Well, the Canadian Life and Insurance Association represents more than 80 private insurance companies in Canada, and we've listed their website here for you where you can find information on private health insurances. Now, lastly, we want you to get connected, and so we've listed a list here of our of the websites that you do need to visit in order for you to get additional information. You register with Healthcare Connect, services for people who are deaf or blind. For the that comes from the Ministry of Children, Community, and Social Services. The ODSP program, Ontario Disability Support Program, library services for people who are blind, Braille resources. We've listed them all here on this list for you. And if you do need them, please feel free to let us know and we can send you this list via email as well. Now, as promised, we're coming to the end of the webinar, and we talked about the resources that we have for you on the Orientation to Ontario's website. We have our website. It's hosted at www.settlement.org/O2O. On our website, we have a workbook, fact sheets, and we also have access to group workshops that you can access once you are here in Canada. We have a settlement organizer, and that settlement organizer is there to help you get settled. Just as it sounds, you're able to put in the things that you need. For example, if you need to go get your Ohip card, if you need to apply for some additional assistance or support, you can put that in the settlement organizer, and it helps you to remember what it is that you need. Our workbook is available in 9 languages: Arabic, Chinese, Farsi, Punjabi, Russian, Spanish, Tagalog, Armenian, Urdu, and it's also in English and French. We also have a handbook on our website that you may download. They're all digitally accessible. Now, we have 19 fact sheets that you can access as well. And just as you're listening to this webinar, we also have live and recorded webinars that you can attend. You can email us through our email if you need additional information. Our email is o2o@costi.org, and you can contact us at 1-855-626-0002. All right. Now, I'd like to thank you for joining us today. Once again, if you do have any questions, please do feel free to send us an email. I know that this webinar is almost an hour long, but there was a lot of information that we felt was critical and important for you to have. Enjoy the rest of your day, and we look forward to hearing from you or seeing you at our other webinars. Thank you so much once again for joining us, and have a fantastic day.